Hello friends, in today's video I will be talking about tissue processing technique in detail. So let's get started. Fixatives. Well, after receiving specimens from the surgery department in a fixative solution, which is usually 10% formalin, the specimen undergoes tissue processing. The mechanism of action of a fixative is by protein-protein cross-linking, which causes fixation and preservation of the morphology of organ or tissue and prevent the autolysis of the tissue by hydrolytic enzymes. The most commonly used fixatives are formalin-based fixatives. The different formulations used are 10% formalin, 10% formal saline, 10% neutral buffered formalin. 10% neutral buffered formalin is a preservative which is the most preferred preservative or fixative and is excellent for tumor tissue IHC and other research purposes. Other fixatives are Boyne's fluid, which is picric acid based fixative and is used in testis biopsy preferably. Carnoy's fixative, which is an alcohol-based fixative and demonstrates the glycogen. Mercuric chloride fixatives, the most common being Zenker's fixative, and the new one is the B5 fixative, and these fixatives are best for reticuloendothelial tissue like bone marrow, spleen, lymph nodes, and thyroid. Other fixatives are potassium dichromate fixatives, which are used for specialized sectioning purposes. Glutaraldehyde, which is used for electron microscopy section. Osmium tetroxide, which is again used for electron microscopy sections. What is an ideal fixative? An ideal fixative is a fixative which should be easy to prepare, penetrate tissue rapidly, should not cause any distortion of the specimen, and keep the specimen in as close as to the normal condition possible. It should also allow subsequent reagents of tissue processing to not cause any harm to the tissue. Now coming to some disadvantages of the fixatives. Well, the disadvantage with formalin fixatives are that they usually leave brown artifactual pigment when stained with H&E stain. Also, the fumes are irritant to eyes and skin. That's why 10% neutral buffered formalin is used, which will not leave any sort of brown artifactual pigmentation, and that's why that's the fixative of choice in routine practice. The mercury chloride fixatives also leave blackish pigmentation, which can be removed during dehydration step by using 0.25% iodine in 80% alcohol and converting mercury chloride to mercuric iodide. The picric acid in Boyne's fixative gives yellowish coloration to the tissue. Some pearl points. The fixative should be more than 40 times the volume of the specimen, and 10% neutral buffered formalin should be used for research purposes, or it's the fixative of choice. Coming to tissue processing. Once the tissue or organ is adequately fixed, then a series of steps are done on the tissue, and these steps are collectively known as tissue processing. The steps of tissue processing are dehydration, dealcoholization or clearing, embedding. Coming to the step dehydration. Well, extraction of water from tissue is known as dehydration, which is done by graded alcohols. The tissue bits are passed through ascending grades of alcohol like 70%, 80%, 95%, and absolute alcohol for dehydration. This can be done using manual method or automated tissue processor. Nowadays, most of the labs are using automated tissue processor worldwide. Ethyl alcohol is the best dehydrating agents, and other dehydrating agents are methyl alcohol, isopropyl alcohol, etc. Coming to the step of clearing. When water is removed from the tissue section, then alcohol which is present in the tissue should also be removed, and this step is known as dealcoholization or clearing. After this step, wax infiltration is done, and this step is also important because wax is not miscible with alcohol, so alcohol should be removed by the clearing agents, which are generally chloroform or toluene or xylene. Newer clearing agents are limolein, which are volatile oil in citrus peels, and clearite, which are long chain aliphatic hydrocarbons. These clearing agents are less hazardous to health, but their results are not good with poorly fixed or poorly dehydrated or poorly sectioned tissue. Coming to the step of paraffin wax infiltration and embedding. After clearing, the tissue is ready for paraffin wax infiltration and embedding. For this, the tissue is placed in molten paraffin wax, generally having a melting point of 56 degrees. After the paraffin wax has infiltrated in the tissue, the wax blocks are made by the help of L molds or nowadays using tissue tech system. Specialized embedding. Well, for bone marrow and liver biopsies, specialized plastic embedding is done nowadays, for which methyl methacrylate, glycol methacrylate, araldite, and epon agents are used. Methyl methacrylate is good for undecalcified tissue. Glycol methacrylate is most widely used in plastic embedding. Araldite is used for complex tissue processing, and epon is used for electron microscopy. This specialized embedding requires special dehydrating agents and clearing agents are expensive. A special microtome is also required for section cutting. Well, this video was made on special request by one of the subscribers. So if you want me to make a video on topic of your choice, do suggest me in the comment section and I will definitely make it. Thank you and bye for now.